Good morning. Hello. Happy Monday, everybody. Welcome. Oh my gosh, it's so great to see each and every one of you. Hi, Clive. Good morning. So today we're going to talk about the COVID surge that we are experiencing here in the US. I'm going to talk about some global details, but specifically, if you are sitting in a state where there's 35 states in total now that are on the rise, I'm going to share information and resources to keep you and your families healthy and safe. So if you are new and joining for the first time, let me introduce myself. My name is Dr. Melissa Gallagher. I'm a naturopathic physician, and my specialty is addressing the root cause of illness and disease. And particularly, I am very versed in hormone balancing, motivating your lymphatics, and detoxification processes within the body, as well as gut healing. And your immune system is involved in many of those. So today, after the news, we're going to talk about specifically the role your thyroid plays in bolstering, modulating, and regulating your immune system. This is really critical because I've gotten a lot of questions from viewers as I've now been doing this live show for over 6 months. Gosh, it's more than 6 months. It's like almost 7 months. And with those questions I have Hashimotos or hypothyroidism. How will this impact my risk? And what involvement does that play on my immunity? So we're going to dig into that today. I'm going to share with you really 4 critical resources that I recommend for a lot of my patients. And then also I'm going to share with you a whole bunch of freebies. And I have a giveaway. So make sure you stay tuned. If you're watching on the live, in about 20 minutes or so, we'll go into that. And then if you're watching on the replay, check in the description box below. I will timestamp that if you want to just skip through. You're sick and tired of hearing COVID news. I totally feel you. So welcome all of you. Oh, Pat says hello. Pat and Ron are going to be running, so we won't have them moderating fully. So anybody who wants to jump in and moderate any of the trollers, be my guest. But let's dig in. Okay, so right now the US is at 8.725 million cases of COVID. We added over 60,000, almost 61,000 new cases yesterday. Our fatalities are at 228,447 lives lost due to COVID. In the world's at 43 million. And we are now seeing India is quickly approaching 8 million new cases, or 8 million total cases. Colombia now is in the million mark. They passed the million mark this weekend. They are seeing a growth. Russia is now seeing massive growth. They're one of the fastest growing European. They're listed in the European countries. Russia is now posting 250 deaths a day, which when we're talking about the US average is close to 1,000, it just seems so minor, but every death is just, it's one too many. Europe now has collectively over 250,000 fatalities. Europe is making up 19% of all of the deaths and 22% of all of the cases. Europe is in a spike. They're in a wave. So I think the full second wave is now hitting them in Europe. Italy has ordered bars and eateries to close as of yesterday, Sunday. And Iran, one of the officials there talked about there being potentially the need to have penalties for COVID violators. So that would qualify as the COVID deniers. They actually took a really major stab at the US and our mismanagement and poor leadership on this whole pandemic. I will say, when it comes to leadership, the White House has said that they are not able, and we will not able to be, or they said will not be able to control the virus, which that's basically giving up. And there are ways to control it. We have seen countries that have been successful. They're just choosing not to do so. They're now saying we've rounded the corner, even though the cases are on a massive trajectory upward. Our average 7-day high, we've posted on average 65, almost 66,000 new cases every day. So the running 7-day average, we're adding almost 66,000 new cases a day. That is outrageously out of control. Friday, we had an all-time high of 83,757 new cases. Saturday was just under that at 83,748 new cases. Sunday came in at the almost 61,000 mark. The White House continues to be a source of spread in multiple ways. The latest super spreading event in the White House is in the vice president's office. Now, 5 cases are linked to the vice president's office. He is continuing, even though he's had close contact. We now know 15 minutes of any type of contact throughout the day is a risk and you should be quarantining. That individual is choosing not to adhere to the CDC guidelines that their own government puts out. And it came out over the weekend that they wanted to hide the fact that there were cases coming out of the vice president's office and did not want to release that publicly. That came from our head, the president's office. And they also are mocking reporters that are in that community and in these close quarters of the Oval Office. And so it's not looking great, friends. So this is my one little thing. You guys know I don't go political, but if you are sick and tired of this BS and the lack of leadership and just the complete meltdown of any type of controlling the virus and getting a handle on things, please go vote. That is the way. I think a lot of us feel like the way out is to vote and change our leadership, because at this rate, we're a laughingstock in all of the countries. And we also have a lot of scientific data and research and amazing clinicians and scientists. One of them I'm going to talk about today that are winning amazing awards for their scientific discoveries and science. And we have that here in the US and we're not doing anything about it. So, hey, Emily, I'm going to show your thanks, Emily. So that is where we stand. We have 35 states with growing cases. New Jersey and Michigan have had record single day cases. Illinois had their highest day over the weekend. They had 6,161 new cases in one day in Illinois. All of these numbers, New Jersey, Michigan, Illinois, they're surpassing that surge we had in the spring that locked everything down. The governor of New Jersey has extended a public health emergency. He's extended it for 30 days in New Jersey. I also want to notate that Texas now surpassed California. Texas is our #1 leading state in quantity of cases. And it's neck and neck. Overnight, Texas posted more cases than California, and boom, they're at 909,000 new cases. It's literally off by a few hundred. California is at 909 as well. Florida is under that at 778,000 cases. These are thousands in total. New York is still at the #4 spot at 500,000 cases. Illinois is at 380,000 new cases, or 380,000 cases. And Georgia's right behind it, 360,000. Let me talk a little bit about what's going on in Texas. El Paso is the epicenter in Texas. It still is not exceeding North Dakota as the world global epicenter right now, but it's very bad. They had 500 new cases Sunday in El Paso alone. They've had a 300% spike, a 300% increase in hospitalizations. That's triggered the governor. I don't think it's the governor. I think it's the local officials. But El Paso is getting a field hospital. I think they're turning one of their convention centers or stadiums into a field hospital. That's like happening right now. And they also have employed a curfew from 10 p.m. to 5 a.m. in El Paso. They're the largest point of spread right now in Texas. This is all while we have voting happening. So that's a whole nother challenge. The largest county in Florida has recommended to limit birthday parties and any gatherings of over 6 or more people. because Florida is increasing. Now we are seeing certain things happening. Like in Oklahoma, they set a record on Saturday, 1,800 new cases just in one day. Oakland, Kansas, cities were allocated COVID funding through that first round of funding. Oakland, Kansas. Now, Kansas is a state that is seeing an increase. Oakland, Kansas, the city officials voted to allocate, I think it was $350,000 to not COVID relief, not PPE, not support of their community, not education, nothing. They decided that they wanted to take that money and they wanted to buy a broadcasting equipment and camera so that they could broadcast live the soccer games at a soccer complex. So that is how a lot of cities are using our hard-earned tax-paying money in relief funding, which is insane. And there's just a whole lot more going on. We have a nursing home in Massachusetts. There's a massive outbreak. 30 residents have been infected. 5 have died, and that's in Chelmsford. There is a North Carolina church that has been barred from holding services. They held services of over 1,000 individuals. And they had from this, I don't know if it's a combined, like our church, we have like 4 or 5 kind of services, like between Saturday and Sunday. So like this church, 1,000 people attended, which leads us to believe that it's one church event. There are 121 cases from this 1,000 plus attended church event. It spans 121 cases over 3 counties. That's just from the attendees. 3 have died. And that doesn't include 127 additional cases from non-attendees, so secondary spread, and those folks are being tested in drive-through services. The health department has said that it's an abatement of imminent injury, and they have issued an order for them to not hold any services until the 6th of November. So that's just another indication people are not being smart. There are leadership that, we have leadership that's just putting people's lives at risk. Indiana Hospital, this is kind of interesting. Indiana Hospital added a germ killing robot. It's a UV light. They've had this in play for 3 years, and they've now since added several of these robots to disinfect the hospital, to help people feel safer, and to also maximize the germ killing capacity. On a sadder note, we have at least the first that I've heard of in this state, University of Darden, a student died who had been exposed and caught COVID. He left campus on the 13th of September. He was on, it was a really severe case. He was in the hospital for multiple weeks, and he was a freshman, an 18 or 19-year-old who died of COVID. We also are seeing, going back to, our lack of leadership here, there are now not specific like CDC or IMHE, but we're seeing data coming in that the political rallies that the president is hosting, they are seeing within 2 weeks increases of spreads. So there are 5 counties that have been rally centers. Thousands of folks, anywhere from 1 to 3 or 4,000, are attending. Back in Florida, they've had 2 events in a senior, like 55 or 65 plus community. It's one of the largest retirement communities in Florida. These communities are attending maskless. There's no social distancing. While some are outdoors, some are indoors. And what they've seen is these 5 counties, they've had in 2 weeks, they've had a spike of 1,500 new cases in these 5 counties. And they are attributing it specifically to our president's rallies. So it's kind of crazy. And I'm sorry, Divine Tau 8. This is just something we have to talk about. We have a leadership that is completely negligent. They are killing individuals here in the US, and it is for lack of leadership, lack of exemplary leadership. There's no mask wearing. We have super spreading events happening at the White House, and it's absolutely negligent. And we are all in this situation because of poor leadership. We are seeing things happening that could have been prevented. We have a lot of data, and we should learn from history. And so, sorry, I'm gonna have to remove you all. If you don't like it, unsubscribe and leave my channel. It just is what it is. I mean, the facts stand for the facts stand for themselves. We have a president that's a super spreader. He caught COVID himself, and the White House is yet again another super spreader event. So that's a fact. I'm not giving you my political opinions. I'm just highlighting facts, and I'm not going to ignore it. The fact that the administration doesn't want to produce this information and tell the American public should be a sign that they're hiding something, or they're embarrassed the fact that they too are susceptible. Everybody's susceptible. This virus affects every age group, every class, every gender, men and women, every racial ethnicity, and our racial and ethnic communities are heavily hit. Many of them are frontliners. Our people of color, our Black, our Hispanic communities are dying more because of this. And it becomes really critical that we all come together and do what we need to do. Speaking of masks, the latest research is showing that if 95% of US citizens wore masks, we would save 100,000 lives. That just is something to be absolutely cognizant of, in terms of if public safety, just like things like what we knew, when I was growing up, seatbelts became more of a thing. Like, it became illegal not to wear a seatbelt. You get pulled over. Kids had to be in, seatbelts. And now we have really safety gear and apparatus that you put kids in. They didn't have that before. And you know what? People balked at that, but it saved lives. And kids now don't die in accidents. We have fewer fatalities from accidents than we did, when we didn't have seatbelts. This is just one of those things. It's part of public health safety. You stop at a red light. If you stop at a red light, when the red light goes red, you can wear a mask. Simple as that. Stop signs, stop lights. There's no difference in terms of public safety and order. Okay. It's leadership, order, organization, and we don't have that. I do want to make another note. The hospitals, this is crazy. So there's been more and more cyber attacks on US hospitals that have been disrupting patient systems. So these hackers are taking the advantage of an overwhelmed system, and they are hacking into the hospital systems. I don't know what that's all about, but I read this article that talked about the cyber attacks have increased at a massive, massive rate. And it would be something that, who knows how that impacts our data. I don't know if they're trying to get in and get access to information, but our electronic medical records, all of our COVID cases, we don't know if there's also any type of trying to meddle with some of the data. Who knows? But that is just something just to know that is happening. Now, this is interesting. So the vaccine distribution, there's been a lot of talk about, the vaccines, really, we're not going to see them hitting the market until maybe late spring, summer, and fall of next year. That's just realistic. Part of the discussion of what the delivery models look like. And again, there's poor leadership in terms of modeling. There's been no sort of communication about what this distribution model would look like when these vaccines do get out there. But one, we know has to be frozen. So that has a different delivery process. Then another one has to be kept liquid, but it's not frozen, but it's at like negative 78 degrees. And that's dry ice and a whole bunch of other stuff. And what this one article I read said, it could pose to be problematic. And so, you just can't easily ship these things in. It's going to take different types of trucks, different type of facilities. You might have different type of packing materials. You're going to need different storage systems. So those are all things that are going to come into play when it is when we're looking at that distribution. And so, it's one of those things predictively, if we don't have a plan right now, that could be another meltdown. It could be another supply chain fiasco if we're not appropriately positioning ourselves to handle these vaccines. One needs to be fully frozen. The other needs to be kept at negative 78 degrees. That is so precise, and it's going to need a specific equipment. And Elsie, yes, I run this channel. I'm parlaying information. If you don't like this data, I'm sorry, you can log off. Everybody seems to like my free information, but when I highlight information that maybe you don't agree with, but is factually oriented, we have super spreaders at the highest level of our government. We have COVID denial and COVIDiots. So I'm sorry if you don't like it, bye-bye. Okay, last and final, before we go into our wonderful content about how to bolster your thyroid to improve your overall gut health and your immune system. This is really exciting. We have a chemist out of California, University of California. She and her discovery for a special COVID testing, I've highlighted it, it's called CRISPR. It's a paper-related COVID test that does not require any type of lab equipment. So it can be easily brought into community centers. You don't have to wait, literally 5 minutes turnaround time. Accuracy is at 98.5%. The accuracy with a positive is 93.1%. The accuracy point, what I meant specifically, 98.5% is, let's see. So it's specificity, which means that it does not report false negatives, which is what we're seeing in the Abbott labs, which is still being used by the White House, even though we have more advanced information. This clinician won the Nobel Prize in the category of chemistry for this invention. Really, really exciting. It's a COVID test that detects the RNA in 5 minutes. And it can be used and works with mobile technology, mobile phones, which is really exciting. So I think that is fantastic. We have a lot of amazing brains working towards solving this dilemma. And essentially, we need to see leadership get out of the way and let the scientists and the folks that are experts in this do their thing, because they are leading the way. And I want to definitely highlight that. The other thing that is getting a little angsty is that on Thursday, remdesivir, which has now been proven not to shorten the time frame of the severity and the days of severity, and also limiting deaths. That's been disproven. And this is the way it works. We are in a novel situation. We're using time and we're waiting to see what happens. What we know is remdesivir should be used early on. It's an antiviral, but it's not effective if you are past the pre-symptomatic phase, okay? So the FDA on Thursday gave the final full approval for remdesivir use. And it's getting a lot of backlash in the scientific community because the specific details on this now disqualified it for that approval. So again, this is where we have a politicized FDA. And apparently the approval that happened on Thursday was faced with and backed by political pressure. So definitely it's a challenge for scientists, and they're getting very frustrated because we've got COVIDiots running our country. And yes, I said that. I said it again. I'm sorry. But the reality is we are now approaching November. And this started, we knew about this in January. The government knew about it. They had plenty of time to get their ducks in a row, and they failed. And the department that was supposed to be in charge of this was disbanded by the president. There are many other things that have been disbanded that could have been helpful. So just putting out there, sorry if you don't like it, you can log off. So anyway, let's get into the gist of our content. Let me look at my timestamp. So today I really wanted to highlight a topic that many of you ask about. You ask about this on a lot of the lives. I see it on a lot of the live chats, and it might be off topic, but I'm articulating and logging everything that you comment, because I do read your comments, and I follow the live chat. And Pat and I usually, she has some communication with me about what's happening on the live anyway. What I noticed is that a lot of you are concerned about your thyroid health. Questions about, I have hypothyroidism or subclinical hypothyroidism. I feel like my thyroid's imbalanced. I have, hyperthyroidism or hashimotos. And will that affect my immune system? And am I at risk with that? So I want to kind of have this topic today answer all of your questions. And comment in the comment box below. For all of you live chats on Instagram, the chat box is below. And then also for all of you on the replay, I'm curious, how many of you are currently dealing with some sort of thyroidal imbalance? I will speak from my personal experience. I've had two kind of states in my life where my thyroid's been imbalanced, and it can be resolved despite what a lot of times you're going to hear. Endocrinologists, I remember seeing one that was like, okay, we need to take out your thyroid. It's like, whoa, time out. No, that is not going to be the approach. But I had a hot cyst. And I've highlighted this in video content to you all before, but it was one of those things where I remember having an MRI, and I did one of those meditation experiences because this is like so close, and they scanned the thyroid, and ultimately had a fine needle aspiration, had fluid removed. It was non-cancerous. The pathologist was actually in the room. That's always bad, like when they're in the room. But I've gone through that personally, and professionally I've worked with hundreds of patients who've had thyroid imbalances. And what I want to highlight to you that's most important and critical for you to know this. One, your thyroid does have a direct impact on your gut health, and it has a direct impact on your immunity. And those two work together. So for instance, some of the things that we know, the TSH, your thyroid stimulating hormone that's produced by your pituitary. So counter to what a lot of people think, the thyroid gland itself doesn't always produce all of the hormones. They're actually produced in other glands. And if you are interested in a free thyroid webinar, I will post this after the fact, but if you go to my website, naturalhealthresources.com, I have a webinar tab. I have a free webinar. It's all about your thyroid. So I'm going to encourage you to take that. It's a free, and it gives you a ton of information, more descriptive than what I am able time-wise to give to you today. But basically, what I want you to know is that your TSH actually produces or triggers the cytokines. So if you have recalled me or are new joining, we have a situation with COVID where the cytokines get exaggerated, and we have what develops, we call it a cytokine storm, an over-inflammatory state. So the TSH regulate the cytokines. If your TSH is imbalanced, your cytokines are not going to be regulated. And the leukocytes, those also coincide with cytokines. Those will also be irregulated. And they, in turn, it's this loop. It's the TSH, cytokines, leukocytes, and then back over to TSH. So we have all of these kind of negative and positive feedback loops within the thyroid cycle. We also see TSH will stimulate T3 and T4 levels. Some of these T3 and T4 levels are directly impacted in the maturation of immune cells, the maturation and regulation of your T and B cells. So the thyroid does play a role. There are thyroid hormones that are required to regulate your immune system. So if you have subclinical hypothyroidism, your doctors and your lab values say you're on point, definitely do take my free thyroid webinar, because I highlight naturopathically and functional medicine, like the guidelines, we tighten things up. So a lot of times when you give blood and you are tested for TSH, that tends to be the one hormone that they test. That doesn't give us a full view. We actually need multiple. We need to see your T3, T4, reverse T3. We need to see the antibodies, the TPO. We need to see other lab values to identify just the full functionality of the thyroid gland and the signaling to the pituitary and back down, from the thyroid down to the liver, and liver back up to the thyroid. There's a lot of things in that loop. And one of the things that we see is that folks that have imbalances in their thyroid gland, any of those levels, TSH, T3, T4, reverse uptake, what we see is that you will be more prone to illness. Particularly, you're more prone and susceptible to colds and flus. Well, we categorize colds and flus also in the COVID category. And so part of that is the deficiency in thyroid hormones. Any one of them, a cascade, imbalances, any of that will directly have an impact on your immunity. And we also know that hypothyroidism directly impacts certain enzyme receptors. So we see CD8 will go on the increase. That increases. That then will trigger thymocytes. And that's your thymus gland. So the thymus gland is an immune gland. It's part of your immune system. It's also part of your lymphatic system. That's the thymus tapping that I've referenced and highlighted before. When CD8 goes up, guess what also gets triggered? Cytokines. So we'll see that triggering automatically. And essentially with COVID, what we want to do in the naturopathic functional medicine world is to eliminate any of the underlying imbalances that might already exist, where you're already inflamed, you already have cytokines at an elevated rate. Maybe they're not overwhelming where the immune system is attacking itself, but it's higher than it should be. So the baseline is already higher. And then you add in COVID exposure, and that's where we could see potentially some of the extremities of COVID taking effect on the body, the cytokine storm. Then we see the whole cascade, the blood clotting, we see the organ failure, we see more of the lung impact. And this is really, really important. Marla says she did my webinar earlier this year and was very informative. Yay. Okay. I appreciate that testimonial to my webinar, because I really built that to answer the information about, I wanted to highlight the information that you all had been asking for. And I really wanted to highlight a lot of those questions that you have. I also wanted to highlight the critical pieces when it comes to what labs you ask for. And I actually have a free download. So there's a lot of good details in that webinar and also on the follow-up email. So if you get into the webinar, you'll get a lot of the emails that I'd set up for that. But today I wanted to explain just that role. Now, there's also a role that the thyroid plays in your gut health. And this is really critical because we see folks that have thyroid imbalances, particularly T3, T4 is all whacked out. We need to have folks really focus in on supporting their liver and their digestive process. We'll also see high cholesterol levels, high triglyceride levels. We'll see estrogen imbalances. So thyroid imbalance is not singular and it's not all by itself. There is this kind of global impact that takes effect in the body. And today, what I want to share with you are a few ways, tactics, and tips to help you start to balance your thyroid gland. Now, my caveat to this, two things. One, the thyroid balance and addressing your thyroid really does require every 3 months to have thyroid testing. So for many of you who are on thyroid medications, you might be seeing your endocrinologist. Maybe it's an endocrinologist. Sometimes it might be a GP, maybe an internist, but usually they schedule 6 months out. That's not enough time. It's too long of a period to be able to make some adjustments. And what I want to notate is that you need to be regularly testing your thyroid gland. You want to have the full spectrum of those tests to see some of these incremental changes. We can start to balance it pretty quickly. And if you're on medication, you need to be monitoring that closely because you could be over medicating. Second thing, the thyroid lab panels and the administration of thyroid medicine. And we're talking about Synthroid and all of the thyroid medications. We see that the thyroid and malpractice, so the lawsuits for malpractice are the highest and the greatest when it comes to the thyroid balance. So this is where a lot of you might be seeing clinicians that don't even want to touch the thyroid because it's too risky. It's too risky from a malpractice perspective. And it's something most of you aren't aware of. Nobody's going to talk to you about it, but that's where I come into play because that's what we know. We know that the greatest quantity of malpractice suits actually have to do with thyroid, either thyroid surgeries, mismanagement of medication. It's very easy to cause what we call a thyroid storm, and that is something that could damage a multitude of organs. The thyroid is really critical. It is a synchronistic gland. It needs to be. It synthesizes a multitude of hormones, and or it is part of that chain. And it is something that a lot of clinicians are not just overly tuned into. So I just want to highlight that specifically. So the other thing I want to notate is that I do have protocols. So I have created specific information and these are downloadable. They are purchasable. So you can buy these and get the download today. I have a protocol for hyperthyroidism, hypo, regular, just general clinical hypothyroidism, hyperthyroidism. So if you have Hashimotos, and then I also have just an overall general thyroid protocol. These are I think they're 12 or 15, 16 pages in length. I issue specific foods that are helpful or could be harmful. I talk about reflexology points on the body that could be impactful. I talk about other hormonal influences, internal and external of your body, that will plague and be a factor. Talk a lot about how to also offset some of the chemicals that we're exposed to, where they are, and what to be conscious of. So definitely do check that out if you haven't checked that out. That is also on my website. You go to my website and there's a tab for digital protocols and you'll find those there. So definitely do check those out. The other thing that is really critical, there's really 3 ways, just base level ways to balance. And this, again, if you fall into hyper, this might not be the most effective, some of them. If you fall into subclinical hypothyroidism and Hashimotos, these will be impactful. So there's different protocols based on each one, but globally, these will have a balancing effect. First and foremost, we need to give our thyroid minerals. And I talk about mineral deficiency. Mineral deficiency overall is the cornerstone for a lot of illness and disease and imbalance that is occurring in the body. We know that certain minerals that we are deficient in will cause a dysfunction of our glands. And the thyroid needs selenium and it needs iodine. Those are 2 really critical minerals. So iodine, I've highlighted to you. I eat seaweed flakes. I use the kelp flakes. I've highlighted in the description box below. You can grab on Amazon. Maine Coast is a small, cute little company up in Maine. They collect and dry different types of Atlantic Ocean growing kelp. And dulse is one of them. Traditional kelp is a seaweed, but there's all different types of marine-based greens. Okay, so marine veggies, like vegetables, grasses that grow in the ocean. They have an abundance of iodine. And the kelp flakes that I use, 1 teaspoon is equivalent of 430% of your iodine intake. And I will put that on eggs. I'll put that in everything. I even put it in sometimes in my yogurt, my little nut yogurt that I do in the mornings with my muesli. So iodine is really critical. You can actually test your iodine levels. I do that with a lot of my patients. You can do a urine sample, a dried urine. We can test for your iodine. So if you're not clear on your deficiencies, you can get tested. You can test for your selenium, your chromium, your magnesium, your iodine. All of those essential elements and essential minerals are going to be critical. So iodine is number 1. A lot of thyroid glandular issues, meaning you get a cyst, like the cyst I had, a goiter. Sometimes people can feel and palpate a goiter. Sometimes they can see it bulging a little bit. A goiter is simply from a lack of iodine. I mean, that is the core cause of a goiter. And some folks will have multiple goiters, and they're kind of fibrotic masses of the thyroid gland. So that is something to be aware of, iodine. The second thing, especially when we're talking about goiters, selenium. So this is just a regular kind of capsule. You can take capsules, you can have dissolvables under your tongue, but selenium, 200 mcgs, sometimes up to 400, depending on if you are in that deficient state, can be helpful for eradicating those goiters. So we've got minerals. My second thing is, I've talked about this a lot. It's been several years since I've been talking about this, but there is an herbal blend that is fantastic. And I've had some folks that have gotten off of their thyroid medication and moved on to this herbal, and it's called Thyroid 1. And it is by Wise Women Herbals. They're an amazing, smaller herbal brand, but extremely potent. They have a sleepy time one that I use a lot. But this Thyroid 1 has 3 critical herbs. It has an herb, it's an Ayurvedic herb called Google. It's not like Google, Google, but it's Guggul. Google is the one herb. The second herb that they have is licorice, and the third is stinging nettle. The magic in this is the Google. Google actually helps your liver. So if folks are having imbalances or deficiencies in T3, T4, and the reverse T3 production, that's all isolated in your liver. So your liver is part of your thyroid function. So supporting your liver is going to be critical. Google does that, and Google is fantastic. A lot of times folks will be put on herbal Google if they want to reduce their cholesterol levels. It does do that, but its core function is to eradicate liver toxicity. It helps to promote the synthesis of the T3, T4, and the reverse of T3. It is phenomenal. It opens up the signaling process between the pituitary, the thyroid, and the liver. And I love that. So Thyroid 1, definitely check that out. That's in my Full Script store. It's not an expensive herbal. And to be honest with you, this would last you at least 2 months, 3 months, depending on how much you're taking. So that is one. My last and final is something I've talked about a little bit. You guys may or may not know this, but with this pandemic, I've actually been doing more online certifications. I now don't have to worry about getting on a plane, leaving my family, leaving my practice to go do certification programs. Now everything's gone digital. It's pretty amazing. So I've, in the summer, I got certified in colostrum therapy, which can address and identify, or can basically, colostrum therapy is a way to use colostrum, nature's first food, to resolve a lot of gut-related imbalances and heal the digestive process while eliminating inflammation and supporting multiple hormone functionality or hormones and their function. One of the amazing things that we see with colostrum therapy, and this is the lab that I love, this is the only lab and company and product that certifies every batch. So a lot of times colostrum is not truly colostrum. This is high quality, and it's in a form that we call liposomal. So it becomes extremely bioavailable to help you heal your digestive process. IBS, Crohn's, colitis resolves with this. There's a lot of clinical data. So this is where we use science and data and research, and this really becomes a critical key player. There's also hormones in this. I've talked about this, I think 2 weeks ago, 3 weeks ago, and I think I introduced this maybe 2 months ago, 3 months ago. But for any of you watching, I will be choosing a comment winner in the YouTube description box. So once this video wraps, please go and comment on the actual video, and I will choose one lucky comment winner. This is a 10 serving sample. So you get 10 days to try out colostrum and see how amazing. It'll repair your stomach lining, your GI lining. It'll promote, there's a lot of good probiotic, prebiotic aspects in this. But the other thing that we see, and we have specific research about the immune involvement, we can see eradication of some of the inflammation that is plaguing Hashimotos. So folks that have autoimmunity, and Hashimotos, if you're not familiar with it, it's where we see, we talked a little bit about the T3, T4, we see that cytokine kind of invigoration. There's a trigger where the TSH and the imbalances in the thyroid hormone, the body actually triggers an immune response where the body actually attacks those cells. So we can see a lot of folks we can see inflamed thyroids. Like sometimes it'll look like an inner tube where folks sometimes, like I have the one little line here, but a lot of times people will have this kind of puffiness, and sometimes it's quite extended. That's because of the inflammatory state of that thyroid. And when we use colostrum, there are hormones that get balanced. We see growth factors, a regulation, a reduction of some of the cytokines. It's amazing the impact that this has. This is best taken on an empty stomach. At night, for sure, is one of the best ways to take it. In the morning, if you might be doing keto, you're totally fine with this. It is okay. This is a very, very clean, standardized process that they use. And I take it, and I honestly, I've seen some improvement in my digestive health. So very, very powerful. And thanks, Emily. She says, don't forget to like and share this video. I appreciate that. Who should not take the colostrum, Valeria? To be honest with you, I think everybody should be on it, especially like I was not a breastfed child. And early on in my 20s, it became very clear, like when I had my health crisis and I was, master's and doctorate, and realizing that I wanted to heal my own body and went for additional education and made a career change. I early on learned through education that your gut is everything. And so when the digestive process is imbalanced, it can cause all sorts of issues. You are not absorbing all the nutrients. You might be eating a lot of really expensive foods and taking supplementation, but you're not assimilating. You're not digesting them properly, and you're not assimilating them. So I really feel like everybody should take them, and especially folks that have been on antibiotics, that have weakened immunity, that have autoimmunity. RA really benefits from this. Asthma can be improved. We've seen the lung tissue can be greatly improved. Lots of clinical research. So there's a lot of data, a lot of scientific research behind colostrum therapy. And there's even more in the works right now. It's exciting. But I really feel like anybody can utilize this. So I've got a link if you want to get this right away. You can also add in bioidentical polypeptides. So these just kind of accentuate the power of colostrum. And this specifically would be something I would add on. I like this spray. They have capsules, but I really like the spray. I feel like the spray really, you can also use in microdosing, meaning little bits throughout the day. But the spray is something you would definitely want to add into colostrum. So you could take your colostrum in a little bit of water at night, empty stomach, away from any type of macronutrients. And then you could take the spray at that time, but also in the morning, throughout the day. This really helps specifically reduce the cytokine overwhelm. So when we talk about in a hypothyroid state, you have an increase of a CD8. This can address, and the CD8 leads to cytokine production. This can help regulate the cytokine production. So there's a direct impact that you can have with this on your thyroid, which is pretty amazing. Nasra, yes, it can help people suffering from Crohn's, digestive autoimmunity, Crohn's, colitis, ulcerative colitis, folks that have gastroparesis, they have ulcers, polyps, all of those, even diverticulitis. What you're doing with colostrum is you're basically giving your body the first food. Like if you've ever breastfed, you're familiar with the colostrum, the difference between colostrum. It looks different. Even how it's coming out feels different than breast milk. But colostrum is what we deliver through breastfeeding. This is not human, but it is bovine, and they're all healthy New Zealand grass-fed bovine colostrum. When we deliver that to our babies via breastfeeding, we enrich their digestive process. And that is how we establishment of the baby's immune response. We establish their gut bacteria levels. The first process is through a vaginal delivery. So if you have a child that was not vaginally delivered, or you yourself was a cesarean baby, colostrum and these bioidentical polypeptides is a critical aspect, because you didn't have that initial process where vaginal delivery, the babies are incorporating through the mouth and their nose, their eyes, the orifice, they're actually absorbing the mother's bacteria, and that's healthy. That protects them. Same with the coating on the skin, it's very protective. So if we don't have vaginal deliveries and we don't have early on colostrum, Or maybe like we had challenges with breastfeeding with Gabriel. And so I'm dosing him on these as well, because I really feel like I didn't give him enough colostrum. And so that's another thing. Google, you can get it in a liquid. Wise Women Herbals also, if you check FullScript, we have Google. But you can also get liquid, you can get it in capsules. And actually several of my thyroid kind of glandular, what I put people on as an alternative to some of the more medicinal, like pharmaceutical medications, they have Google in it. And so it's part of it. Kelly says, appreciate all your information I've been sharing on my Facebook page. Thank you. You have 3 inches. Oh my gosh, she's got snow. Holy cow. That's amazing. It's turned a little cooler here. I thought it was warm this morning, so I put a dress on. I'm gonna have to change. It's kind of cold, but not yet super cold. But the leaves are changing, and so I hope you enjoy your snow, Kelly. Yeah, so Norma has a really classic example. When you're younger, you have hyper, and then you go hypo. So hyper can move into hypo, and it's just the gland is just in a state where it's kind of, I describe it, and this is not clinical, but it's like blowing out the thyroid. Literally, it's just revving up. So this is like our transmission. The thyroid, it's revving so much, the thyroid, it literally will blow the engine. And so what happens is if we don't catch hyper on the beginning stage, it can then switch very easily. Some people get, irradiated, they take radiation capsules. One of my college roommates did that. They did that to her over Christmas break. So she went home from college, got the radiation capsules, and then had to stay like 6 to 7 feet away from family for like 10 days during her Christmas break. She was so hyperthyroid, like her hypothyroidism was so bad. Her eyes started to bulge out a little bit, and she even had seizures. So it can be very, very overwhelming. Pow, what are the doses for children? 7 to 14. So with like 7, I would do half of a dose, but 14, I would put on an adult dose. So like they have 3 levels of dosage. We have preventative is 1 teaspoon twice a day. If you want therapeutic and even anti-aging, like this is great for your skin, friends. So like there's a lot of superficial benefits as well. And then, so the anti-aging therapeutic would be 2 teaspoons. So if a child has a lot of digestive challenges, 2 teaspoons. And then weight or diabetics could take 1 teaspoon 4 times a day. So this has if you're a diabetic, this is another another way to impact that. And this is literally, they list it on the back, the dosing instructions. So make sure you guys that you comment on the on the video, on the replay once it gets wrapped. Sherry, I sell this. You can, there's a link directly. It takes you to a landing page. So check in the click down in the description box below, but you can get the Sovereign Labs. I've got a lot of folks on this, and they're noticing a big difference. And I also am, one of my next kind of webinar lectures, I'm giving a discussion topic about colostrum and gut healing, IBS, SIBO, and things like that. So I'll be digging further into that in, I think it's clinically focused, but I'm talking to other doctors, nurses, and going to educate them about that. And also how to communicate to patients in kind of social world like this. So Cherie, definitely, I think you would greatly benefit. So make sure you comment, definitely check out the links down below. And friends, I've got to run. Gabriel has a one-on-one with his teacher. They're doing a little evaluation with him. But I really appreciate all of you for sticking in. I see there's a lot of you. Please give me a thumbs up, hit that share button. Make sure you comment on the video down below. And you guys know my channel is all about health and wellness. The challenge with COVID is now there's some blending in terms of just the political side. But I don't ever go into politics, and I really try and refrain from that. But I think we're just in a situation now where the facts are just showcasing it is what it is. And that has unfortunately been a statement from poor leadership. And I'm hoping that we'll see us get through this. But, if we don't, we could be in this for a year or 2 more. Nashra, you guys can contact me on my website. Definitely check out my website, www.naturalhealthresources.com. You get access to my free thyroid webinar. Buy your protocols if you want to address general thyroid health, hyperthyroidism, Hashimotos, very impactful. I think you'll find that beneficial. So thank you for tuning in. Tune in Wednesday. I'm going to be talking about more stuff, more details. I've got lots of content for you. And my goal is to keep you healthy and well. And that's always where my heart is. And I know many of you who are my regulars, you know where my heart is. So for all of you new joining, I welcome you. I hope you will subscribe, hit that like button, hit the share, and join me on Wednesday. Thanks, everybody. Have a great day. Bye. See you guys later.